Good afternoon to everyone who's here. I am Milka Javier, the marketing manager of Generali Life Assurance Philippines Inc. So I'm hoping that you can hear me now. All right, so I'm very happy to welcome you all to our online session this afternoon entitled All in the Mind. So thank you for taking some time off from your busy schedules to join us this afternoon. So over the past months, the pandemic has really brought great stress to people due to the quarantine and its effects on people's usual routines or livelihoods, heightened levels of anxiety and stress, depression, sleeping problems, worsening chronic conditions, and mental health issues are expected to rise. So your employees may be experiencing one or two or even all of these effects, and you might not really be aware of it. So last year, the Philippine Mental Health Act has been signed into law, and in February of this year, the Department of Labor and Employment has made it mandatory for all, as in mandatory for all workplaces and business entities to have an established mental health policy and program. As your partner in providing life and health protection to your employees, we generally see this as something very important, and we would like to help our clients, just like you in attendance today, to have a better understanding of the Mental Health Act and the mental health workplace guidelines set by the Department of Labor and Employment. Our webinar today aims to increase everyone's awareness on the Mental Health Act and DOLE's policy and provide thorough knowledge that will enable you to build a mental health inclusive workplace. But before we officially start the program, I just have a few reminders for everyone. We will be putting you all on mute mode so that we can all clearly hear our speakers during their discussions. But don't you worry, later on we will be opening the live Q&A box. You will be able to see that later on. And should you have any questions or clarifications that pop into your mind, so jot it down first, and then when you open the live Q&A chat box, you will be able to type in your questions, and our speakers will do their best to answer it during the designated question and answer session. So, all right, without much further ado, let's begin All in the Mind. Our first speaker is a graduate of Ateneo de Manila University with a degree in Bachelor of Science, major in Psychology, and Master of Arts in Counseling Psychology. He is also a graduate of Friedrich Ebert Stiftung Academy of Political Management and a fellow courtesy of Asian Institute of Management's Future Bridging Leaders Program. He is a licensed psychologist and psychometrician and a certified mental health first aid practitioner. He is the founder and program lead of Project Tahanan, a mental health management toolkit which aims to help communities, organizations, and professionals develop grassroots and participatory mental health protocols. He is also the Chief Operating Officer and Lead Psychologist of MoodChamp, a mental health tech startup developing publicly available mental health solutions. He is also the co-creator and host of Padonate ng Sanity, a podcast focused on live conversations regarding mental health and other social issues. He's also a volunteer technical advisor for free telecounseling service on mental health by the Office of Senator Risa Hontiveros. On the other hand, our other speaker is a Bachelor of Science in Geography graduate from the University of the Philippines, Diliman, and gained his Doctor of Philosophy in Organizational Development from the Southeast Asia Interdisciplinary and Development Institute. He finished an executive certification program in organizational development from Stanford University Center for Professional Development and a certified neurolinguistic programming master practitioner. He is the current head of people operations and culture systems of an accounting and legal outsourcing firm, a co-founder, principal consultant, and trainer of Neurolinguistic Programming Manila. The Neurolinguistic Program, or NLP, is a human communications technology that produces long-lasting personal changes, which in turn extends to professional and organizational change. He is a human behavior and communication specialist, a soft skills trainer, and an HR organization development consultant. He's a highly skilled corporate leadership training and team building facilitator, educator, research instructor, and academic consultant for the past 18 years. His current areas of expertise include NLP-based training programs, organization behavior management, coaching and mentoring, leadership development training focused on positive organization mindsets and behavior, transformative leadership, instructional development and technology, and action research in organizations. So let us all welcome on screen Mr. AJ Song Lao and Dr. Noel Silan.
Hello everyone, good afternoon. Can everyone see me? So ako na magsimula. Hi, I'm AJ, I'm a psychologist. I'm honored to be joined today by Dr. Noel. So today we'll be talking about the mental health in general, and of course the Mental Health Act and the recent DOLE guidelines for mental health policy in the workplace. Right now, it's very relevant for us. Lalo nga na ngayong COVID, we're really experiencing a lot of adaptations and a lot of changes brought about the current situation and of course the stress that comes with it. So without further ado, I'll start sharing my screen now, and feel free to keep your keep your questions till later, and we'll try our best to answer them. So for this topic, again, it's all about mental health. Ang usapan ng mental health ay it's something that's been going up in terms of interest, in terms of focus in the past few years. 2 years ago, the Mental Health Act was signed after 21 years of lobbying to Congress and through Senate. And this was really a hard-fought battle. I think this is Dr. Santa Risa Ontiveros mismo who really pushed for this act to come to fruition with the help of multiple advocacy groups, really centering on youth groups. So, nung medyo bata-bata pa kami yung mga nasa labas, kami yung mga nagbibigay ng mga talk, kami nagbibigay ng mga education para sa mga tao, para mas ma-appreciate nila yung mental health. Ngayon na may act na to, kailangan natin palawigin. Ano ba, saan ba dapat merong mental health policy? Saan ba dapat ng programa? So for this topic, we're really just gonna have an overview of mental in the Philippines, the Mental Health Act, and then of course, the policies and programs in the workplace to help our employees and our own mental health. As I was introduced, I'm a psychologist and I'm a mental advocate. I graduated from Ateneo University, and incoming, I'm also a scholar for the London School of Hygiene and Tropical Medicine for their global mental health program. Siguro for this slide, because we're done with introductions, I'd like to ground on the fact that we are all affected by the pandemic. Lahat tayo apektado niyan, lahat tayo hindi naman sa naghihirap, pero nararamdaman natin ang mga pagbabago sa ating buhay. So even as psychologists, we're affected by it too, even if we know better. More so that we know better, sometimes it's harder for us to also recover from it. So these are the things that we're really working through. Because diba, in our lifetimes naman, walang nabuhay sa ibang mga pandemya sa scale nito. So that's something that I hope everyone brings to them while we listen to this conversation on mental health. So introducing Sir Noel, maybe you can introduce yourself a bit more para marinig ka na din naman nila.
Hi, good afternoon. I'm honored to be here. Thank you, AJ, for bringing me here and for Generali too. And if you can see, I didn't use the red background because there is what we call color psychology, and this color at my back suits me, and then the picture also. And that's one thing that we tell people, just like you, to be able to be more aware of your surroundings. So this is what I do. I study human behavior. In fact, I'm the younger version of AJ at school in that sense because I'm still finishing another degree in Ateneo. It's counseling psychology. And I'm happy to be here. So back to you, AJ.
So maybe can you talk a bit about NLP before we continue?
Okay. So NLP is neuro-linguistic programming. It's how a person thinks, and it's the study about how the thinking pattern of humans actually occur. So basically, we are answering questions like why people speak and behave the way they do, and the emotions that they feel. Now, language is about language, how we use language. Unfortunately, a lot of people are not mindful of the language that they use. Just an example, people would say, hindi ako magaling sa math. And we would say, hindi pa ako magaling sa math. Because adding one word actually opens possibilities for you. Without that, it's absolute. And there will be a lot of that in that system as you go along. And then programming is our conditioning. And whether you like it or not, guys, your primary core system, your personality, your value system, most of them were formed during your first 5 years in life. And can they be reprogrammed? And the answer is yes. So this is what we do. It's a study of mind, body, and emotion, and it's a triadic system. And when we do training and consulting, we particularly pay attention to behaviors of people because it's fun. And that's what we do. So you can look for us at our website. It's nlpmanila.com. And I'm here. And I'm happy to be here. And I'm happy to be with you guys. Magandang hapon sa inyong lahat.
Right. So thank you, Sir Noel. So with that, that's a good jumping point to really mental health. Dahil kasi ba pag-usapan tayo ng mental health, meron tayong mga preconceived notions, may mga paniniwala na may mga naisip na tayo ng mga bagay-bagay na could be specific or could really come about on how mental health was formed in us. Pero what NLP is showing us and why we start with that slide is really some of the things that we're going to be talking about might feel big, pero it's all about those mga small changes, small nudges. Di natin kailangan ibahin ang bagong sistema, ang lahat ng sistema natin. Di natin kailangan ibahin ang kung anong alam natin para mag-make room sa mental health. Dahil mula bata pa tayo, may mental health na tayo. Pero di na natin ito pinag-usapan sa paraan na pinag-usapan natin ngayon. So what is mental health first? So mental health is really a state of well-being in which an individual can realize what's their ability to cope, ano yung limitations, what's the scope that they can do it, and how they can cope, ano yung mga strategies that works for them for the normal stresses of life. Ang keyword dito ay normal. Dahil nga, we get used to certain kinds of stresses growing up. That's why certain people are more resilient. One very common Filipino thing na ating nag-usapan na you're very resilient to storms, to typhoons. But the thing is, we grew up with it, diba? From our parents, from our grandparents, then from different generations, we grew up facing different kinds of storms, and that has formed resiliency within us. So that becomes our normal. But in our context right now, COVID, no one has a baseline of what normal is. So talagang gapangan on how do we address it. So why is mental health important? The strongest line that we can put in for it is there is no such thing as health without mental health. Mental health is part of the public health pie that we use to value ano ba ang aspeto that makes someone healthy. Of course, there's physical health. There's making sure that you exercise. There's making sure that you get the vitamins that you need, you get the nutrients that you need. And then, of course, there's social health. Of course, you socialize, we're social beings. And then there's mental health, there's our psychological health that allows us to really function, that allows us to really be ourselves. Bad mental health makes it harder for us to live through the days. May mga panahon ba kayo na talagang ayaw nyo bumangon? Kahit okay naman ang tulog nyo, kahit wala mong masama sa inyo, pero for no reason that you can link to, it's just harder to wake up that morning. Or may mga panahon ba na you're okay, pero biglang ayaw mo magtrabaho. Hindi ka makafocus. Or, mas common ngayon, yung pakiramdam na naninikip ang dibdib nyo. Breathing becomes heavier, it becomes faster, and you feel like, oh, what's happening to me? It's scary. That's what we call anxiety. So, bad mental health really, really affects us. But good mental health, it might be one of the silent things that we take for granted. Because good mental health is what allows us to go through our day like it was normal. It's what allows us to have a good day. It's what allows us to be happy, to be productive, to have good relationships, to have good outlook on the world. Kung paano natin tinatanggap ang mas sa buhay natin, that's because of our good mental health. So, if it's something like that, ba't parang siya mahirap pag-usapan? And for the Philippines, there's two common reasons why. One is culture and language. Our culture doesn't readily support mental health. For almost every talk I have, I ask this question, and you don't need to uh, chat this up. Just think about it on your own. When when you think of mental health in your endemic language, so sa native language nyo, kung Bisaya, Kapampangan, Ilocano, Ilonggo, Pangasinan, in your endemic language, what does mental health directly translate to? Ano yung direct translation niyo for it? Sorry. So I'll give you a few seconds to just maybe think about it. And the next question there is, does it sound right? Tama ba yung tama ba yung feel ng word na yun? For example, sa Tagalog, kalusugang pangkaisipan, parang wala siya nung tindig eh. Wala siya nung tama that we usually expect from the Filipino language. Diba? Usually pag Filipino, pag Tagalog, pag sanay ka na, pag lengguwahe mo, may tama sa'yo eh. Pero ito wala. So, our culture views mental health very differently. And the way that we talk about, the way I'm going to talk about it specifically, the way that science, the way that that professionals talk about it might not be the same way that we readily talk about it sa pang-araw-araw. The second point, ba't siya mahirap pag-usapan, na invisible siya. Hindi mo siya nakita. Hindi mo siya pwede hawakan. Hindi mo siya maamoy. Hanggang ramdam lang talaga ng taong nakaranas nun. And this is important to note. Dahil kahit invisible siya, the impact is very real. Recently, I just gave a talk on productivity. And one key point that I wanted to really reach out to people ay about procrastination. Dahil meron tayong mga mindset minsan na pag tayo nagpo-procrastinate, ito ay sign ng tayo tamad, we're lazy. But with evidence right now for the past 2 years, we know that procrastination is an anxiety response. It's a psychological response for people that feel like the task that they're going to do or the outcome of the task that they're going to do will lead them to either failure or to something bad. So kaysa gawin natin agad, instead of getting it over with, we'll prolong it and give ourselves that handicap. So ngayon, we're realizing the things that we might associate badly to a person to not really be something just about the person. It's now procrastination can be looked at as, oh, it's an emotion, it's an actual distress, it's anxiety. So talagang kailangan pag-ibig ng perspective natin because we might put images or faces to it but not really fully understand what's about. Now, the bigger thing here is really the impact of COVID. First note dito ay COVID, the quarantine, this entire situation we've had for the past 5 to 6 months is not normal. This is not normal. And the acknowledgement is important dahil some of us might think that our normal ways of coping might work, and it could. It definitely could. Pero for the others, for those that might be affected a bit more directly, or for those that might be having a harder time, the quote-unquote normal ways of coping might not be enough. It has hit our mental health hard. Really, really hard. And apart from an actual health crisis, there is also a quarantine state. So just last week, we went back to MECQ. So that's hitting our mental health because di tayo sanay. For the longest time, especially if you've been working for a while, you have made your routines to follow your work. So you wake up at 5 a.m., leave at 5:30 or 6, commute for an hour or two, go to work, leave work, then go home. Then minsan, yung mga occasional na labas kasama ng co-workmates, mag-gym, gala kasama ng barkada, uminom, mag-karaoke, mga ganyang bagay di natin nagagawa eh. And those are things that we actually had to mourn. And now, because we're in months into the quarantine, we're looking at, how do we fully adapt to it? And adapting isn't hard. Adapting isn't easy. Diba? Ngayon, diba, traveling, there may be a lot of people in the chat right now who had travel plans in 2020. May mga taong gusto pumunta ng Japan, umuwi ng probinsya, makikipag-birthday sa pamilya sa probinsya, or pumunta somewhere in the Philippines that they haven't been to before. Or may yearly tradition sila of somewhere they go to every year with family. Mga bagay nito, we might have lost. So talagang importante nga na marami ang impact sa atin kahit di natin ano. Kasi 'di ba? Minsan our mindset is, oh, we're safe, we're home, we're okay. But yes, what we're objectively okay. But mental health wise and psychologically, nasa na tayo doon? There's also that issue of work from home. Na a lot of us aren't used to work from home. Or some of us in the chat might have employees that cannot work from home. So how do we now help them really de-stress, process the stress of working at home? Dahil some of us might have very stressful home environments. Baka you're a parent, you have young kids, and how do you set boundaries with your kids? Or you have employees that have to go to the office. How do you help them alleviate the stress that they might be feeling going to work? So, and then of course, the obvious thing, some of us are scared of getting ill or becoming carriers and getting our family or friends or colleagues sick as well. So, ang daming psychological impact pala ng pandemya ito sa atin that we might not be really taking into account. This is why this law, the Mental Health Act, is so important. Because of Republic Act 11036, nagkaroon tayo ngayon ng legitimacy para pag-usapan ng mental health sa iba't ibang spasyo, like this one. The Mental Health Act aims to really integrate mental health services with the promotion of the services itself and protection of people who use the services. And of course, establishment of a council. Because before the Mental Health Act, there was no centralized body to really oversee mental health in the country. At the same time, there wasn't really clear protection for people who have mental health issues, and people were afraid to go into mental health either as an industry or as a profession. For example, in my batch for board exams, there was only 200 professionals, and that has been the most number of O-takers they've had that year. We're about I guess a little over 1,400 to 1,500 psychologists in the entire country, around 1,600 psychiatrists in the entire country for a population of 100 million. And the Mental Health Act now helps us as professionals really bring this message to your doorstep. Dahil nga importante ang mental health. The biggest takeaway for the Mental Health Act that I want you to have for this talk is really its protection for diversity. Sorry, it's promotion for diversity and protection from discrimination. Mental health has often been a talking point for discrimination our entire lives. I grew up with the stigma, with the mindset na yung taong gumagala, the homeless person walking around my street, ay baliw, ay siraulo. And they're not getting the help that they need. There are a lot of people that are afraid to disclose their gender identity, their sexual orientation, their mental health condition, all of these, because of possible backlash from the community or shame from that quote unquote label. The Mental Health Act has strengthened really the rights of service users. Service users are those that really have with experiences with living with any mental health condition or any traumatic experience. So this includes people who are bullied, people who might have disabilities, or people who might face discrimination because of their identity. For example, for the LGBT community, there's often discrimination that pag LGBT ka, HIV positive ka na. And that's obviously not true, but they still face discrimination because of it. And HIV is considered as a possible disability. For example, for neurological disabilities, let's say ADHD, autism, learning disabilities, there are now more safety nets for kids, for adults to use to help themselves really protect their rights as individuals. And this is important dahil the more we talk about mental health, the more we get into the human person. Talking about mental health means talking about vulnerability, talking about trust. And when someone trusts you and they disclose, oh, I'm bipolar, I have ADHD, I have autism, like I have high functioning autism, for example, or um, I'm thinking of what are the common ones. I'm seeing a therapist. I'm taking mental health medicine. They should be able. They should be in an environment where, oh, yeah, okay, thank you for telling me. We'll take note of that and we'll act accordingly. It highlights the the act also highlights that in diversity we can strengthen not just our workforce but the entire population because we empower everyone in it to be able to be their best selves. So when it comes to innovation, when it comes to their productivity, when it comes to their work, when it comes to their identities, they can be who they want to be without fear of either being stamped down because of it or being shunned because of it. So I touched briefly on this before. Uh, in the text below, those are the common perceptions of mental health in the Philippines. Some of them are things that I've heard even to this day. Thankfully, less and less among the younger population, but still exists, especially in rural communities, sa mga probinsya natin, or even in the peri-urban, so yung mga nasa Rizal, Bulacan, na pagka meron ka mental health issue, mahina ka. Ah, yung batang yan, mangmang yan. But he has a disability. That's what we call a learning disorder. Na the very image of female mental health issues, si Sisa, from Jose Rizal's work. Ang mental health pang mayaman. To an extent, that has some backing because mental health services one-on-one specifically are expensive. The cheapest sessions that you can find for a mental health session with a private clinic is probably around 1,000 pesos per hour of therapy, and that's the cheapest. There are free services available, but then they're usually backlogged. The worst backlog I remember from PGH and NCMH, the National Center for Mental Health, were around 3 to 4 months to 6 months. Right now, National Center for Mental Health does not take in new patients minus very critical inpatient care because they have their own COVID situation and they've had issues with their management in the past few months. The other more common, quote unquote, more benign perceptions of it are really people with mental health conditions, baka nag-drugs yan. And for the past years, that's also a very dangerous perception to have because of the violence that some people get because of the perception that they use quote unquote drugs. Sometimes there's criticism on parenting. Kung may mental issue ka, your parents might have not raised you well. Na oh, you might be you might be homeless. Kaya ka may issues. Or baka nasapian ka. Or you might be on your period for women. Or I remember this is something common within my own parents that we had to really work on to extinguish was may kulang sa tornilyo nila. Sa utak nila. That's why they're like that. That's why they're talking on their own. That's why they're out on the streets, even though they're educated professionals. And these are all perceptions that the law helps us now, gives us legitimacy to help extinguish and make extinct. Dahil ang mental health ay none of this. Ang mental health ay human conditions, human situations that come from very complex problems, very complex roots. So, dito siguro, usapan ngayon tayo ng stigma. Importante pag-usapan natin stigma dahil ang stigma ay isa mga pinakamalaking rason why mahirap pag-usapan ng mental health. It's why certain companies and certain workplaces still don't really want to bring in mental health in their workspace because they don't want the stigma that comes with it to follow. Sir Noel, from your experiences and working with different companies, how has stigma played a part or how is it kind of manifested? Sir Noel? Oh, sorry.
Yep, can you hear me?
So, yeah,
Yeah.
I can.
Sorry for asking that.
Yeah.
Um, mental health is not really something that's still openly discussed about when we talk about workplace behavioral dynamics. Even among managers, it's they tiptoe on the topic of mental health. They're concerned about it, and yet they don't really want to talk much about it. Much more with the common employees, as you mentioned, there's that stigma that if you go see a psychologist, a psychiatrist, a counselor, something is fundamentally wrong with you, and you're not fit to be able to do your work, which is totally not true. And unfortunately, there's that stigma. So as AJ mentioned, those are the words used. You can even hear them from time to time up to now. Although, on the other hand, the good thing about that is that a lot of the younger generation now are more open to discussing it. So it's not yet culturally acceptable, and yet it's making headway already.
Yeah. And I think just to support that, thank you, Sir Noel, is really to support those initial headways that we have, because people already discern it. People know it matters. Younger generations matter. We have high school organizations really dedicated to improving mental health within their school. We have college groups that are pushing for it right now. We have professional organizations like the ones that I'm currently in that are really pushing for better mental reform in different spaces. And as part of the Mental Health Act and my transition to the mental health in the workplace guidelines from DOLE, reducing and eliminating stigma are really main responsibilities that we had to now take on. Because stigma does not belong in any safe space. And that's the goal. We want to make our workplaces a safe space. So just some current numbers for people to like latch on. As I mentioned earlier, there's an estimate of around 2,000 practicing psychiatrists for a population of 100 million. While in the mental health law, we consider social workers, mental health nurses, so nurses specifically trained for mental health, and guidance counselors to be mental professionals. They do not have the same trainings to really deal with clinical mental health issues that psychologists and psychiatrists are trained for. So usually pag ganon, may certain limitations that they can do. Right now, there are issues of even life coaches tackling mental health. And with that, I'd just like you to practice a bit of caution. Because while life coaches can receive basic mental health training, they might not have the same level of experience or expertise when it comes to really escalating and elevating really more complex problems. This is why, for example, Sir Noel is very skilled life coach, very skilled in NLP. When it comes to more clinical problems, nagtatandem na kami dyan. So really knowing your limitations and your scope, because not everyone going to not going for seeking help will have clinical issues. Some might have issues on family, some might have relationship issues, some might have career issues. And those are the things that these other professionals might be in a better space to tackle. Pero pagka yun nga, trauma na, they were raped, they were harmed by they were in an accident, they were traumatized, they're feeling very anxious, more so than normal, more so than they're able to cope with. Then maybe ito na tayong, let's tap a psychologist, psychiatrist. In the past, uh, in 2 months of the early part of the quarantine, from April to June, there has been thousands of hours logged across the multiple pro bono services that was made specifically to address COVID. So this was the one of the services I have pushed for, which was with Senator Rizal's office, UP PsychServe, a UST, PGH, In Touch. Uh, I'm not sure if Natasha Gober was still functioning. Ogot Foundation also had it. So there were around a dozen of it. I know PMHA and PPA also had free services. So there were thousands that were really flocking to these services. And this was so surprising because these were not the usual numbers these clinics usually get, even before COVID. So we know that because of COVID, nagkaroon talaga ng surge. And that surge is something that we're only expecting to still grow because for mental health, the impact can be delayed. Last point is really accessibility because 2/3 of all mental health professionals that are practicing are situated in highly urbanized spaces. So Metro Manila, Cebu, Baguio, Davao, Cagayan de Oro, Dumaguete, so the cities talaga. And that becomes a problem because what if we're not in the city? Especially now. Especially if people are at their provinces or at their homes away from these cities, how do we seek the services? So those are the things that a workplace policy will help bridge. So this is the byline in the Mental Health Act that I think you as HR managers might really value. Employers shall receive appropriate policies and programs on mental health in the workplace designed to raise awareness on mental health issues, correct the stigma and discrimination association with mental health conditions, and identify and provide support for individuals at risk and facilitate access of individuals with these mental conditions to the treatment and support they need. So this is clear that meron tayong responsibilities as employers, as workplaces, to really help our employees with their mental health. So, eto na. How do we protect the mental health of our company? So, maraming bagay ito. Some of the things that we're going to talk about might be things that you're already doing. Some of them might be new. So, we're just going to be making it more explicit as per the DOLE guidelines. So, the DOLE guidelines was actually released this February 2020. And if it was not for COVID, actually dapat mas malakas ang start nito. As early as March and April, there were multiple talks similar to this that are already banked and planned for us to be able to develop and plan for mental health policies and programs in our workplaces. But with COVID happening, it became more complicated because, of course, we had to adapt, we had to adjust to the situation. But now we're going back to it because in the past months since the quarantine started, the pandemic has taken a toll on our mental health. And I think this could be something that's felt a lot by workplaces that never stop, even through the quarantine. Baka yung mga burnout mga employees ninyo, they might be feeling a bit more stressed, they might be feeling a bit more tired. Depending on what demographic you are, you might be affected differently. If you're, our brothers and sisters who are Muslim experience it differently. They had to celebrate Eid, their faith differently across this pandemic, across quarantine. The LGBT community, especially those suffering from HIV, would had to really adapt to it because they couldn't get their meds as easily as before. People who were ill, people who were immunocompromised, people with underlying conditions or live with those that are at risk. Elderly, if you live with your parents, if you live with people with asthma, with history of lung disease or cancer, mas nakatakot dahil mas madali silang mahawa. So that affects you too. And those with children, if for example, if you're a parent or if you're living with a sibling or relatives or kids, they're suddenly out of school. I'm not sure if you know this, kaka-announce na ito, DepEd is pushing back the start of schooling to October 5 from August 24. So, laking bagay nun. Kasi imagine nyo, for most of the, it will be now for most of the year that the school-age children might not be in school or taking classes. And that's a big thing. Kasi it affects the parents mismo. Siyempre, sino mag-aalaga ng bata? How do we make sure that they're okay? And at the same time, it affects the kids because what do they do? Sorry. So, we're now going to move forward with siguro the components of the mental policy. Because madalas tanong sa akin, ano ba ang parts ng policy? What does a policy look like? What do programs look like? So, I divided it into 4 parts, into advocacy, health promotion, social policy, and support mechanisms. So please bear with me, ito yung mga medyo mas technical na usapan dahil ito na yung mga different things that you might need to take off if you currently have it or if you don't, or if you have possible issues in implementing these, especially from a work from home environment. First is all workers need to be provided with the basic information regarding both mental health and the mental health law. So basically what I shared to you kanina, some of those things they might need to be made aware of, especially if they themselves have mental health issues. They need to be made aware of their rights, and it's up to the workplace to inform them of it. And then the other part of advocacy is really how do we spread it? How do we make sure that our workplace remains not just a mental health safe space, but also a space that keeps promoting it? So dito na papasok ang ating trainings, ang ating promotion, uh, ating promotion of whatever policies, programs that we will have in place. So part of this could be existing maybe team buildings, R&R. You might actually have to take a look at those. Are our team building seminars or our R&Rs really meant or really made for better mental health? Baka R&R natin masaya, pero that's not the same as better mental health. So baka kailangan natin tulungan natin employees. The best practices for advocacy, for building advocacy or building any policy in general, is a co-creative process. Using the bridging leadership framework that's really forefronted by the Asian Institute of Management, co-creation allows all stakeholders. So in this case, management, employees, and even to an extent, possibly the clients that you have, to have a say or to have input in how to build the best practice policy you can have. Dito talaga, I cannot stress enough, workers need to have a say. We cannot have a mental health policy that is just really top down, because if it's something that the employees either can't utilize or would not want to utilize, then the policy might be one, either ineffective or two, waste of resources. So this is really where the advocacy comes in, communicating it to them, training and promoting them, and advocating for them. So the second point is really about health promotion. So health promotion is all about increasing awareness on mental health to the workforce. So this is not just about mental health. This is all about all aspects of health. So physical health to, kahit corny man ng Zumba, but if it works for your company, why not? Diba? If right now, actually, corny might be something that's good kasi it's something's different. And onti lang ang magagawa natin as a workplace for people in remote spaces. We're still really figuring that part out. So whatever sticks, there's no one size fits all. And part of this is really focusing on preventive. Dito rin papasok yung mga health assessments. In companies, it's often people do pulses. So mga kamustahan check-ins, check in your people. Baka may mga bagay na things that they're not disclosing to you because they don't want you to know it kasi nahiya sila or takot sila pag nalaman mo, I haven't been feeling alright. Or I want you to put you in the position of and to consider how does it feel kaya for an employee to say I'm not doing well because my mental health hasn't been there. If you think about it, that's a very valid reason kasi your mental health's not there. So it's a question of, okay, what to do. Pero for us to know what to do, we have to know what's the problem first. So being able to promote that openness. These, Sir Noel will talk about this later, yung mga change management practices natin with our employees, within our systems. Because sometimes our health systems that are currently existing might be counterintuitive to the mental health policies that we want to have in place. And of course, capacity building our leaders to better really address. Dahil if our leaders themselves can model, can be the icons for mental health safety, mental health openness, better mental health in the workplace, it can become a trigger for the employees themselves to also become and kind of mirror that and shadow that. Third point is social policy. These include the practices and some of the social contracts that we make with our employees. So as I mentioned kanina, non-discriminatory practices are a must. Ensuring confidentiality, understanding ano ba yung disclosure natin. With confidentiality, usually confidentiality is a must for any health condition. It's only disclosed when it comes to emergencies. Although we want to promote better disclosure among our employees. Na the ideal space is everyone knows what everyone's dealing with. You know that I'm dealing with, let's say, symptoms of ADHD. And you know, as my teammate, I know that person is dealing with their anxiety. because us knowing allows us to adjust, allows us to really build forward whatever interaction, whatever relationship we have with each other. But again, this is one of those things that's hard, easy said, hard done. Dahil nga, to promote disclosure, you have to first create the space. You have to create the platform for them to be able to feel safe for it. And of course, um, work arrangements and accommodations for the context of mental health. I think for a lot of for a lot of people, work from home works well. It's just that, of course, the pandemic and everything is really making it harder for them to cope. But understand that certain people might need certain accommodations. Like I think one could be shift times. I've had patients that have to request a message because their mental condition makes it very difficult for them to uh, take on graveyard shifts. And this person, for example, has very severe insomnia, and their graveyard shift works against, let's say, the treatment or the medicine that they're currently taking to help with their insomnia. So, may mga ganung bagay lang you have to be aware of. Last point ko dito before I turn to Sir Noel is really the support mechanisms. So, this is really treatment, rehabilitation, and referral systems. Referral systems need to be a bit more dynamic dahil nga we don't have a lot of access points for mental health in the country. So, it's really being about being creative with it and being aware kung ano ba yung mga pwede natin ibigay sa kanila. And I know generally we might talk about that a bit in the future. The other is, of course, integrating mental health to compensation benefits. Certain companies right now have certain programs now for their mental health. Actually, may mga iba pa nga na they have, I forgot the term for this, dynamic benefits programs for multiple factors of health. So may mga metrics sila for, let's say, physical health, social health, emotional and psychological health, that if you score high on, dadagdag ang quote-unquote benefits mo. Let's say you have extra days of leave, you have extra, let's say, meron ka in office or in workplace store na credits for it. So may mga ganong things that you can do. Of course, again, consult with your workforce, consult with the people in your teams. The lastly is really support mechanism programs. We have to be able to support everyone. And the thing is, the challenge with mental health is not everyone will need the same kind of support. So that nuancing needs to be in place and identify, syempre, in your teams. This could be best done in a team setting. If you have a team of 5, one of them is, I guess, might have a bit more anxiety. Let's say, kinakabahan siya tuwing mag-meeting kayo. How do you as a leader, how do you as an employer really help them parang shed that, really help them move away from that? Dahil an anxious employee will not make for a productive one. So, So ito, so we'll talk about more concrete ways and approaches that you as a company could really tackle it. So Noel? Nakamute ka ho. You're muted.
Yeah.
There we go.
Before I discuss what you can see on your LCD, let me go back to what AJ mentioned a little bit earlier when he translated some phrases in Filipino, because it's really important for us to be more conscious of the words that we use. For example, and as AJ mentioned, and we really believe this, a lot of us are really anxious right now. Unfortunately, we don't have the capability to express it because, for one, it's not consciously aware. So there's part of our subconscious that's really much aware of it, and yet verbally and behaviorally and linguistically, we're not really able to express it. For example, you ask a person, "Kumusta ka? How are you?" And you would notice that they're not really that good or that well when they say, "Okay naman." So take note of the intonation, "Okay naman." Although that's common in the Philippines prior to COVID, it's much more emphasized or exaggerated right now. And in NLP, we say, when you listen, listen with your eyes, listen with your ears. We don't just listen here, we listen here. And that's a giveaway actually to how a person is feeling. And we say, we don't even ask, are you bothered? Uh, are you anxious and so on? So let's say there's a word in Filipino called bothered. It's called nababagabag. But how many Filipinos are actually going to use that word? So they're just going to say, hindi ako makapag-relax and so on. So at this point, I'm going to ask you, be mindful about the words that you use because words themselves actually have influence already in your personal psyche and in the psyche of others. So going through the uh, bullet items that you've seen, just last August 6th, I gave a talk to ADB and it's almost the same. The question they posed on me was, given this abnormal situation, can we even act normally, quote unquote? And I said, depends on how we define what normal is. So there's a relative normalcy in an abnormal situations. And how do we do that? And when we do that, we also discuss and deal with mental health issues. So, for example, in organizations, and I've been consulting not just in the organization where I'm at right now. I'm uh, I have had conversations with many private companies before, and Globe and Smart among them, and Cebu Pacific and people from PAL. And take note, these are pre-COVID. And it's the same thing. It's just during the time of COVID, everything gets enhanced and exaggerated. And usually, um, before we do any program at all, like you're going to institute a mental health program. What we did in our place was to institute a systems-wide survey. But take note, again, the reason why I mentioned that be careful about the words that you use is when we do survey, we don't ask questions like, how anxious are you? Because that word itself may trigger something in them already. So we ask questions like, how well do you sleep at night in a scale of 1 to 10? Or how much focus can you give to your work at the work site or work from home in a scale of 1 to 10? Or how comfortable are you? Or if you want to be more neutral, how do you manage? How much do you manage during the time of pandemic? So there is an art and a science in terms of asking questions in the survey itself. So when you conduct survey, please, I'm going to ask you really, please take note of the questions you ask because some of them may be leading questions and biases. In the world where I come from, we are positively biased. So we ask, how comfortable are you at dealing with the pandemic? There is already an embedded suggestion that you can be comfortable even in this uncertain situation. So there's going to be more of that whenever, if ever, we discuss um, item analysis and word statement analysis and so on. It's just that we first start with leveling the playing field. Where are we right now in terms of being stressed and being anxious? But we don't exactly ask people those exact words. Second would be communicate frequently. So what we do now, we have we touch base with our leaders. We have 4 sites right now in this company that I'm giving full consultancy with, although I consult with other companies as well. We touch base with division leaders every week, 1 hour a week. So we have leadership concept infusion, we have kumustahan, and so on and so forth. And of course, part of that would be how is the mental state of your staff? We don't forget to ask each other that because we know, coming from our mental health policy and program, that people are now stressed. And it's not a make believe because it's coming from the survey. And research has shown us that at the same time. And then the other one would be manage expectations. And I have long before COVID, I've already told people about this. You want to manage your expectations so that you can deal with life in general better. It works in a personal manner, it works in a professional manner as well. In fact, from time to time, I do marriage counseling, but that's more like marriage refereeing. And we always say to the couple, manage expectations from each other. I cannot emphasize so much how important this one is for you because if you do this, if you do only one of the things that we're going to share here, like what AJ shared with you, the only thing I'm going to ask you would be to remember to manage your expectations. When you do that, my friends, I'm telling you, your level of stress and anxiety will go down. And you have to manage based from reality, There is an ideal, it's what a stretch is all about. And then there is almost an impossibility, like you want to go back to normal next month. That's not going to happen. But you want to go back to relative normalcy given the social distancing and other health and hygienic approaches that we have, then I could say, yeah, it's possible. So manage expectations. More of that when we have another session, maybe. And in fact, for all of you who are listening here, if you look for my Facebook account or my our website, I actually wrote, and I'm going to digress a little. I actually wrote a year ago, marriage operating manual, and you didn't hear it wrong. I said marriage operating manual. So for those who are in a serious relationship, you better get hold of that document so you can manage your relationship with the other person and there will be less friction. Take note, these things are not going to take away the anxiety, it's going to reduce it. Not going to take away the friction, it's going to reduce it. The other point would be prepared to be surprised. COVID has shown us that if you still believe in fantasy thinking, then you can still do that and then put your feet on the ground as well. And what are surprises? Well, in NCR, we don't know what's going to happen on a week to week basis. Seems to be crazy, but actually it is. So be prepared to be surprised. You can actually make yourself believe that and make yourself feel it as well. It's more being curious than being fixed minded. And then we have think and act differently. And how do you know that you have to do that? Well, when you have done everything that you have done before and then they result to the same thing. In NLP, we say you want something new, then do something different. And then we say less is more, particularly right now, what AJ has shared with you. If you don't have a mental health program, that's okay. In my experience up to now, let's say I have dealt with 100 companies, 99 companies out of 100 don't have mental health program. They say they have mental health and well-being, but they don't actually deal with the psyche. They don't deal with the psycho-emotional aspect in general. They deal with the physical aspect of the people like Zumba, weights, running in place, threads, fun run, and so on. But rarely are the organizations with HR program that particularly deal with psycho-emotional issues. What I've realized really after decades working with private corporations and public institutions as well is that there is an unstated but black and white assumption that when you are at the workplace, you can deal with your own psycho-emotional issues. There is that underlying subconscious belief, especially among leaders, that you're old enough, you're a professional, then you can deal with your psycho-emotional issues. Doesn't really happen that way. And yet the realization is there, the culture is there. So less is more. Begin with whatever you have. This is a very good time for you to start it. Doesn't need to be complex now. It's going to be a step-by-step process. There will be some exploration. There will be some uh, not exactly appropriate program, and you can do that by iteration. The important thing, as AJ said, would be there would be a um, buy-in, not just from the top management, but also from the employees level as well. And take note, when we do that, we'd like, and I forgot to write it here, I'd like you guys to think in systems, particularly the leaders among you. Think in systems. Unfortunately, 95% of people are events-oriented. Kung ano lang yung nakikita nila, that's just how they're going to react to things. Only 5% are systems-oriented, like politics aside, but a lot of people are blaming the 16 million, and I say, don't blame them. These guys hope for a better future. And if you're going to blame, then look at it systemically. What we have here is generational, 100 years of neglect in Philippine politics, and this is what we have now. So think in systems, and we go back to um, psycho-emotional and mental health program. What are the things that will enable the program to work, that enable people to buy it in, and what are the disabling mechanisms? you do not think in system, it's not going to really work well. So part of the program will be managing psycho-emotional stress. And there will be a lot of that when you create your mental health program. The most common now that you're going to hear would be mindfulness. So it's just being living in the here and now, because COVID actually taught us that we cannot rely on the future. We don't know. So it's going to be good if we can be more comfortable in our own skin right now, being uncertain. It's sort of oxymoronic and paradoxical, but can you be comfortable being in an ambiguous situation? Can you be can you be comfortable rather in an ambiguous situation? Can you be comfortable in uncertainty? And the answer is yes, if you manage your expectations. So another part of mindfulness would be yoga, breathing, stretching, and so on. And those are really good things. Of course, going to the arts world, paint, sculpt, sing, dance, as AJ mentioned, do Zumba, be in the moment. Easy to say, difficult to do, and yet doable. Any one of you can do that right now. Be here, here, right now. And don't even think about 5 seconds from now. I know it's difficult, and yet it's doable. And then part of the management of psycho-emotional stress would be creating a day-to-day structure. A structure is a chart, a matrix, a schedule of activities that you follow habitually, day to day. Like if you start doing your, let's say, 2 minutes of mindfulness or 3 minutes of mindfulness at 9 a.m. on a Monday, then you do it on a Tuesday, and then you do it on a Wednesday. And after some time, it becomes a habit. Somebody said, you do it 21 times in 21 days. You do it once a day at least for 21 days, and then it becomes a habit, and then you don't even need to think about it. You just do it. Now, mind, body, and emotion system, this is what we deal with at NLP. There's a big question beyond mental health. Can a person really transform into something else in terms of behavior and thinking? And the answer is yes. When what we think and the language that we use and the feeling that we have coming from our body, they get aligned, then the change is possible. It may not be that fast, but it's going to happen. And unfortunately, we don't have enough time to tell you more about mind, body, and emotion system. But all of you guys know this. You have accidentally encountered this in the past. You're just not aware of it. And that's what NLP does. It puts things in methodological and orderly fashion. NLP is a practical psychology in motion. Right? So, looking at the next slide, I only have 2 slides for you guys, but this is comprehensive enough. Um, I mentioned less is more. Um, and then deal with your AQ. What's AQ? That's your um, adversity quotient. That became popular in the 1990s. You know the equivalent of AQ now? It's called Golf India Romeo, uh, Golf Romeo India Tango, grit, determination. So AQ is the ability to thrive, to survive and thrive in environment where challenges are really, really great, just like here right now with the pandemic. Some people are folding, their psyche are folding, some people are surviving, and some people are thriving. And what's the difference? It's in the mind body system. And sometimes you get so confused, let your body speak for you. Right now, how do you guys feel? Right now, how do you feel? And for you to be able to answer that, I'm going to ask all of you, you can simply close your eyes for a bit and just breathe and feel your body. I know there are a lot of distractions, but if you can feel your body, you would know part of it is okay and part of it is not okay. And you're going to be able to deal with that more as you get to know more about your body. Unfortunately, the educational system doesn't really tell us or teach us more how to be in touch with our own inner workings. So introspection is one, and feeling our body is another. So you even talk to parts of our body. So AQ is important, the ability to face challenges and then overcome it either by first running away and then facing it again or simply facing it now. And what we want to avoid would be freezing, like frozen. I cannot think anymore, and that's common. So it's still common. It's okay to freeze. It's just not probably okay to freeze for long. The important thing is we have a plan. And for us to be able to do that, then write your plan. So in terms of coaching, we also have what we call action plan. It's not just about talk. It's also the ability to execute what we're discussing right here, right now. And so the last thing I'm going to say would be the question I was asked by one of the participants. What's the line between life coaching and then the probable clinical aspect of the client? Um, one of the biggest things you have to watch out for when you're doing mentoring or coaching would be the behavior of the person. If the person's perception, both visual and auditory, is really beyond normal, like they're getting in the way of good work or good relationship, and it has been ongoing for a certain period of time, like more than 2 weeks to around 6 months, then that's when the clinical aspect or clinical diagnosis has to come in. Unfortunately, today, not even just today, but a decade back, a lot of people are using the word depression in a very nonchalant way. There is what we call normal depression, so day-to-day feeling bad, not wanting to move, and there's that clinical depression that's heavier and that's more difficult. Now, if you're doing life coaching, I would really suggest you get to learn more about counseling because that's going to help you a lot. So I do life coaching, but I started as guidance counselor and then I studied NLP as practical psychology in action because it's more techniques and concepts in practical terms. And that's why also I mentioned I'm still studying right now, finishing my counseling psychology to put all those things together. So just to summarize all these things for you guys, some of these things your normal cognition may probably forget, but I'm pretty sure your subconscious are now attuned to this. Manage your expectations. If that's the only thing you're going to remember, that thing particularly is going to help you thrive and survive, not just during this time of pandemic, but beyond. And that's it, folks. Good afternoon.
Yeah,
AJ,
thank
back to
you.
you.
Yeah. Yeah. So just to close, last reminders na lang siguro. So this is more a bit more personal dahil before we take care of other people, uh, before we take care of other people, we should take care of ourselves first. So
Yeah.
we make it a joke na mga dance session, yoga, yung mga nakatuwang bagay pag weekends or Sundays or Netflix, whatever coping that you can get your hands on right now that fulfills you, that satisfies you, do it. Kahit sabihin mong, oh, baka masyado ako matanda dyan. Why not? Diba? You can start, diba? May maraming tao ngayon, maraming bata ngayon ang natutong magtahi. And that's usually a joke that we give for people that are a bit older. Or may mga ano ngayon, may mga tao ngayon na nag-aalaga ng halaman. Or may mga tao na nagpapahinga. As in, it's productive rest. Di mo kailangan actively gumawa ng kahit anong bagay. Whatever works for you, works for you. So just continue it. Kasi nga, it's really okay to not be okay right now. Dahil
Yeah.
nga nasa pandemya pa tayo, at kahit sino naman talaga ay mapapagod. Lalo na sa katagal-tagal. We've been in this situation for months and months now. And given that we're really still adjusting and adapting, it's okay to not always be 100%. So, yeah, so just to end, please fill your cup before you share it with someone else. Lalo na sa HR, kayo madalas ang titignan ng mga tao to help out, to be the ones sa puntahan when there's problems or issues. Make sure that you're able to take care of yourself. So just here a bit of profile. If you want to look me up, I'm on LinkedIn. And if you want to email me, here's that. I'm also, as mentioned earlier, I'm hosting a podcast called Padit ng Sanity. It's really about the Filipino style of Filipino mental health. And we're talking about different topics. So we're starting season 2. We just started season 2 this week. And we're really moving forward to talk about different issues such as we just talked about pet ownership dahil iba rin ang maging pet owner sa panahon ngayon dahil you can't walk them. Lalo na if your pet is a bit demanding or you live in a condo na medyo stuffy, medyo not as open, or what if you're a teacher? Or what if, ano yung perspective ng mga teachers natin? Dahil mahirap maging guro sa panahon ngayon. So we have topics like that that happen and topics that are as interesting in the future. And of course, here's how you contact Sir Noel. Again, he's NLP is a powerful tool, and it's something that we hope that we integrate to the entire system. Dahil ang mental health, hindi lang naman to therapy. Hindi lang naman to self-care. Marami itong in-betweens that we can use and look at. And the best practice really is to have all of them available as much as possible for people. But given that we have limited resources, you have to understand what are the strategies and techniques that might be the most useful for the people we're trying to help. So yeah, so thank you very much. Milka?
All right. Thank you, Dr. Noel and Sir AJ. And I do believe that a lot of us are become more aware with regards to the Mental Health Act and the mental health policies in the workplace. So it's true after all that when we are in a good mental health state, it allows us to become happier, more productive, and see the goodness in everything and have a greater outlook in life. So right now, we have opened the Q&A box, so you can see that below your screen. So you can type in your questions. So we already have one right here. Okay. The first question is the mental health law directed only to citizens of the Philippines who are employed in private sectors?
Okay, for me, so I can answer that. The answer is, first, Philippine laws apply to Filipino citizens. So, and to an extent, if you're a foreigner working here, it will apply to you in the limited capacity that it applies to all foreigners. So this is basic labor considerations. Mas actually nga, if you're a foreigner from a Western country, likely your own mental health law will be magnitudes more stringent than what we have in the Philippines right now. What is interesting though is while the mental health law focuses on the population, DOLE's act is really more focused on workplaces mismo. So if you're a company based in the Philippines, you're signed under DOLE, sakop ka nila. Given the private sector, yes, the DOLE is private sector, but if you're in public sector, for example, the CSC will have their own protocols. Actually, medyo mas one step higher sa CSC kasi may sariling part sa CSC responsibility is part ng CSC responsibility ay yung responsibilities of the different public offices.
Right. There's a follow-up question though. If it applies to all, why is it that the focus is in private companies?
Because in private companies, dito, for one, we have to understand then, for the working population, almost everyone who is employed will be in the private sector. So that's one. So DOLE will need their own guidelines for it. And dahil nga trabaho ng DOLE, diba, the best association I have with this is OSH, Occupational Safety and Health. The mental health, the DOLE guidelines are actually tied very closely to the existing occupational safety and health laws we have for workplaces. So, syempre, those apply to private companies dahil nga they need to be self-governing. And we have to make sure that dahil nga governments are not always in these companies, they can promote whatever is in the law. Actually, it took a while. It took a year for DOLE to release their guidelines from the signing of the law. Kasi when the law was signed, it was just really that one slide they gave on the employer responsibilities. So they needed to really nuance it and understand, what are the other laws we need to integrate? They had to integrate it with OSH, with disability, with VAUSI, with gender, with violence against women and children, with GAD, gender and development practices already in workplaces. So all of these apply at the same time. It's just that hindi siya explicitly for mental health until recently.
Okay. I've been seeing questions being typed in sa
Chat.
chat
Yeah.
box, but I'll be reading those also in a little while. But there's another question from the Q&A box. So, on the mental health law, what is the minimum requirement for HRs or workplace?
So that's gonna be a policy in the programs. So that's the minimum dapat may policy kayo in subsequent programs. And the policy, and this is more of a critical understanding of what policy is. A policy needs to always have a program or a plan after it. Hindi pwedeng papel lang siya na yun lang. And that's what actually what DOLE will look at. Yung mga yung mga programs niyo, what are in the policy, so may adherence ba kayo to the policy set? Kasi ito ba, you can ang dali mag-write up ng very powerful policy, pero mas mahirap yung implementation, mas mahirap yung monitoring, and mas mahirap yung pag disseminate niya to the entire workforce, especially if you're working in a very huge, in a very complex work environment, such as work from home. Hmm.
Okay, so another question that we got is how can we respond to our team members struggling with mental health challenges that eventually affect his work performance that needs to be called out to?
So
Yeah, very well. So,
let me answer that. That's why the mental health policy, set of policy, particularly the mental health program, needs to be instituted because most of the time, in my experience, when somebody has been noticed to exhibit, let's say, psychological, emotional um, anxiety in that sense, who are they really going to go to in terms of when we're talking about corporate work, but even in the government system itself, they have HR programs that they don't have. It's almost nada. It's almost not there. As I told you earlier, 99% of the companies and even government institutions right now in the Philippines, they don't have any program in the HR set of bigger programs that deal particularly with the mental health issue. So the question is, so what do you do? Then you look for, it's usually going to follow the protocol. Who can best help them? And that's the question. That's the only question you can really ask when you don't have the program. Who can best help the person in terms of dealing with psycho-emotional issues? Definitely it's going to be along the leadership rank. And yet who among them is trained to do, let's say, life coaching or counseling for that matter. Some rare companies, they have their own psychology, so they're sent to the psychologist. And yet, as somebody asked earlier, what's the distinction between a normal psycho-emotional issues and one that needs more, let's say, diagnosis in a clinical setting? So that's actually a big question. There's no black and white answer to that. So that's why the program is really important because even before COVID, it has already been a big problem. I've known personally some trainees and participants in our seminar workshop who have asked, how do you deal with that? How do you deal with a colleague who has committed suicide, jumped on the seventh floor, fell on the driveway of their office building? And the guy was so young. How do you deal with that? So all these things are, and even for that person at all, did he or she even exhibited manifestations that he is or she is going to commit self-harm? So the need is really urgent right now.
can you follow up? I think this was so some questions in the chat. Do not wait until you have a case
Yeah,
of either suicide or self-harm that it will either go viral, become public, and DOLE will audit you. Do not wait for that. Because again, we don't will they audit this year? We don't know because again, COVID is really hard on everyone right now, especially government. But do not wait for you to have a case before you move on this. Because this is life and death. It can come
yeah,
to that. And I've been handling clients for the entirety of COVID. I've had an average siguro of 1 to 2 a week of high risk suicidal cases
yeah,
who were not at all anywhere near that in the past months before it. Some of them might have existing Conscious na. And but the thing is, there's a lot that we don't know
Yeah.
just because we don't have the data and we don't have any baselines because, again, this is new. This is something that we've only really been scratching the surface of.
And that's why in the companies I consulted with, even right now, we have what we call volunteers counseling group. So volunteers counselors are given training and workshops how to do basic counseling, what to look for in that sense, as what AJ shared with you. What could be the red flag? But mind you, even psychologists and psychiatrists themselves can get to be fooled by some people
Yeah,
who are so good at hiding this thing. You only get to know it when it's done.
yeah,
So there are no securities here. There's only reducing the probabilities.
yeah. So safety nets talaga.
So it would be good for you guys if you don't have, let's say, a mental health program to partner with third parties for now, and then maybe prepare your own people eventually, some months or years from now, to be able to handle your own mental health program.
Okay. For our next question, what will it take for the Philippines to have mental health patients just walk to a hospital and get an audience with a competent mental health practitioner? It's like pag may flu, punta ng hospital, then papa-check up.
One is, of course, and this is sobrang sakit na sabihin. PhilHealth coverage. That's one for mental health.
Yeah.
And this is so relevant right now because PhilHealth is going through a very terrible time. We need parang for the Philippines to be at that state because that's the state, for example, of the NHS in the UK, where part of general practitioner pool will be licensed psychologists and psychiatrists. So pumunta ka lang doon, usually a GP or let's say a trained health practitioner, maybe a nurse or something in between or an orderly will be able to give you a basic assessment. From that point, dun ka na ilalobby. Dito kasi nga, kulang yung mga professionals to do that. We have very few clinics that can even take mental health emergencies. Even fewer that do mental health walk-ins, that do non-emergency cases na hindi on a parang scheduled basis. The best pa rin is nga if we have better HMO. One is HMO coverage and the other is PhilHealth. PhilHealth is really general dahil universal health siya. This is actually part of Universal Health, the Universal Health Act that we've been pushing to strengthen for a while now. Pero again, it's a lot of competition kasi sa Pilipinas when it comes to resources. Of course, diabetes, cancer, chronic illnesses will be more resource intensive. That's more immediately life and death. Pero of course, in the underlying parts of it, mental health needs to be funded as well. That's why in certain sectors, and this is siguro to share na rin of some of the programs that I implemented myself. I recently helped launch a 24/7 service, no full psychologist. It's expensive, pero imagine we're catching 200 plus employees with one-on-one 1 hour sessions a month. And so that's really, ngayon, may sense of kampante na si company. It's a big company. It's tens of thousands of employees nila. Kasi anytime na may they don't have to deal with it anymore. Parang HR does not have to think about, they only have to think about if something flags. And those are the rarer cases. Pero they know if may nag-flag man yan, may tao na kaya mag-handle nito, or there are other people that can do it na. So that's really these kinds of things. Other programs that we have, or other programs that we have, or this is pre-COVID, kasi mas common to pre-COVID, honestly, or training sessions. So skills trainings for certain people in the employee. Although this is a bit difficult kung malaki kayo kasi it means you have to train more people. So there's those kinds of nuancing that you have to take in. If you want to really, really capture and make a safety net, it would need a lot of co-creation. So it's really consultancy na. From your company to someone like me or someone like Sir Noel on developing a robust mental health system. Sir Noel, kayo, kumusta yung mga consultancies niyo when it comes to the programs? For mental health related.
Well, before I answer that, I'd like to go back to that question. What will it take for the Philippines? It's going to take one generation for this thing to
Yeah.
change. But we've started already. You know that there is that national law for
Yeah.
mental health. And it's, as I mentioned, we have to think in systems. Um, we start with prevention, we start with orientation, coming from the basic education itself, not just with high school, but even for grade school as well. We talk about mental health as something normal. It's just like you tell kids to do physical exercises, then we have to be able to have programs for kids to teach them to be able to take care of their mental health as well. Like meditation for grade school, it's being done by some private schools, mindfulness activities,
Same
and so
here.
on.
Same here does
Um,
grade school.
and then we have the employers. What will it take for private employers, private companies, and even government institutions to make sure that there is the program as mandated by law and it's executed as well? What will it take for the government to make the corporations and public institutions execute those things? One example would be requiring all future employees and even current employees to undergo, let's say, orientation about mental health and basic training in being able to be more mindful and so on and so forth as part of their promotion system, as part of their employment process and so on. So, yeah, one generation. Because where will it start? It starts with the leaders of the country. And if they're not supportive of this, it's going to be an uphill Sisyphusian. It's going to be a battle that's really difficult to fight. So we start where we can. In terms of my personal experiences in consulting with other companies, as I mentioned, very few companies have a built-in program that deals with the psycho-emotional stuff of people. For a few companies that I know of, they have what you call in-house coaching. So for me personally, I'd rather call it coaching in that
Yeah.
sense than do counseling because as AJ mentioned, there's still that stigma. So I call it coaching counseling. And I have to explain it to the people. When I say counseling, it simply means dealing with your psycho-emotional stress of the moment. And most of the time, it's behavioral modification, achieving the goals that you have. So I know a few companies have their built-in coaches, but I can count them with one hand, minus two, minus two fingers. So ganon kakonte ang existing companies with programs that deals really with mental health.
So also, will management be required to have an in-house counselor or psychologist? No. Di
No,
naman, wala namang specific sa law na kailangan
wala.
in-house. Pero, there are best practices that do have it. I remember there's one company, I can't name it lang, that they have a life coach system in place and still get external therapists. Talagang covered sila to the entire system and it's been doing them wonders for productivity, especially during this pandemic. I think tumaas yung if I'm remembering their report, tumaas yung productivity ng company nila through the pandemic. Kasi nga yung sumalo ng bigat na yon were the mental health programs that already had in place.
Yep. So as I mentioned, using the word
Yeah.
coaching, but actually it's coaching, makes it easier for people to come on board.
Yeah.
Now there's that question, what does access to MH program policy really mean? As AJ mentioned already, part of that would be giving easy access for them for mental health care. And one of them would be part of HMO,
Mhm.
could be PhilHealth, could be something more. And then, which is the greater problem of all, where do they now access, where do they go in terms of psychological help or worse would be psychiatrist help, given the lack of resources in terms of professionals in our country? Majority of them are based in NCR.
Yeah.
More than half of all existing psychologists and psychiatrists in the Philippines are in Metro Manila. How about the provinces? They go to the albularyo,
Yeah.
unfortunately. Yeah. So that's what it's meant by access.
Yeah.
And then, of course, data privacy. Like if they go there, it's not supposed to be published
Yeah.
in the communication system of the company.
Okay, so we're down to our last three questions. So, mental health is very personal to an individual and aggravated by stigma. So can you share successful company programs that's really availed or adhered to by employees, if any?
Well, I could mention one based from my own experience, and that would be the BPO. It's called Taskas, because I gave them NLP practitioners training for their coaches, and they're very serious about it. For every level and every site, they have in-house coaches,
Yeah.
and so any case that a coach cannot handle anymore, as AJ mentioned, is forwarded to their affiliate psychologist. But then I can only think of one or two. So
Yeah.
we still have to
So
build it from the bottoms up.
So just to add that, yeah, yung ginawa ko nga, it's a program. So I made a program for a company to help develop a 24/7 service. So the service, I think, is shared between two sister companies ata.
Yeah,
So there's really tens of thousands of employees nila. And they just sign up. Parang may sign up lang sila, and um di takot magbayad yung mga pasyente. So kasi nga not everyone will come in with similar problems. May mga tao that one and done. You only need one session. You need just to let it out, talk about it with someone who's both a professional, to a coach, and that's it. And then others naman, they go, we really need um, expanded care. Like I've been dealing with patients that have really serious problems, serious issues like rape, suicide nga. We've had patients that was reported to be hospitalized for mental health related issues. And the problem kasi doon is pag na-hospital sila, where do they now go? And
yeah,
because these companies have these programs in place nga in-house, sila yung sasalo. So even if it's the moment na de-escalate na and hindi na at risk, stable enough si employee to do online counseling, they go now to the program. And again, that's 200 to 300 sessions a month across thousands of people. You're preventing, one thing that you have to realize is preventing um, incidents regarding mental health protects other people and company as well. If
yeah,
something happens to your coworkers, that will deeply affect you, especially if you're close, especially if you understand what they're going through. By protecting that one person who is at high risk, you're helping protect tens to hundreds more that could be affected if something ever happens to them because of their mental health.
yep. You know, the funny thing about that, AJ and friends, is that um, the workplace where you can find easy access to counselor, that's in the academic setting.
Yeah,
Because guidance counselors are required for all
yeah,
schools. The funny thing about that is that those who actually need them as well, the faculty members, they don't readily go and see the guidance counselor simply because of the stigma, as AJ mentioned. So it's sort of ironic that way.
Okay. Second to the last question to be answered by our speakers. What provisions of the Philippine mental health law protects its employees suffering from mental health issues that is being bullied by his or her coworkers or the company itself?
So and I mentioned, the rights of people with mental conditions is one of the first. I think it's the second. Oh, first is definition of terms ng law. Second is the rights of service users. So it's the most important part of it talaga. Kasi kailangan, we have these rights have never been verbalized legally before in this manner. So really having it there. And um, where can you go to? Honestly, it's dependent. So if it's a workplace, DOLE is always the first thing that comes to mind. If, for example,
Yeah,
you're working in the public sector, CSC, and they have certain, so this is the touch on, there are certain penalties that are already there. Actually nga kung personal to, the penalties might be even, it will be different kasi nga it can actually go as discrimination cases na.
yeah,
And discrimination cases will follow existing laws against discrimination. So yeah, it could actually become criminal as well because it also could become in the form of harassment or abuse.
yep.
Um, sorry, go.
Yeah, the bullying itself by
Yeah,
itself already is something that can be handled by the discipline committee. If
yeah,
you have ideally all corporations have that. For government institutions, there is already an existing provision for that. It's called the grievance committee, and all private corporations are supposed to have that. So it's basically a protocol thing, and then the case can be handled citing all those laws that support it. that protects the people from bullying, at the minimum from bullying, much more with sexual discrimination and mental health discrimination and so on. So the question is, does the company have that at all if it's a private company? Because most of the time they just do it by protocol, like elevate it to the supervisor, and the supervisor throws it to the manager, and the manager can either work on it or throw it to the VP. And usually, a lot of corporations now have some built-in process for that.
And this, to highlight this is also a lot more sensitive when it comes to gender and sex, especially for women, because women do face significant discrimination. Even though the Philippines is one of the best ranking countries for gender equality, but we still do have issues on harassment,
Yeah.
and we often underplay it or downplay it. Harassment is a form of discrimination, or not handling harassment properly by management is already a form of discrimination in itself.
Okay, for the last question, what are the penalties for non-compliance to the minimum requirements?
So for the penalties for non-compliance, this will, based on the especially the guidelines for DOLE, these go hand in hand with OSH penalties. So these are usually daily penalties ranging from, I think, as cheap as 1,000 pesos a day to 100,000 pesos a day, depending on severity, depending on the what's quote unquote lacking. To be honest, one of the main difficulty here is that because of COVID, DOLE hasn't really had time to parang
Polish
create,
it.
to polish it on the ground. Right now, a lot of the companies that we're talking about either do it, either obligation of contract. Some companies are obligated to have very robust mental health systems because of the type of work that they do. Others are doing it because they're seeing the need. And actually, how this talk started about, how this conversation started, because that we saw the need. People started seeing the need of mental health in their workplaces. It's just that right now, we are in a very opportune time that we have these DOLE setups in place. But again, it's harder for you to be caught off guard. Because it's either you're caught off guard by DOLE in the same, bigla naisipin nila mag-audit sila. Like, we don't know, they suddenly might start doing it, or you have a case that puts your company now in a very difficult position because it had a case where someone either lost their life or someone made a complaint online. And it's so easy, diba? It's so easy to be put in that position right now na magiging viral kayo for something that happens to the people in your company. So those are the things that we're really also helping prevent. Kasi that doesn't help anyone.
All right. So thank you, Sir AJ and Dr. Noel, and thank you to everyone who typed in their questions. Unfortunately, we won't be able to answer all of those. So I'd like to again extend my heartfelt thank yous to Mr. AJ Sunglao and Dr. Noel Silan for gracing us with your presence today, this afternoon, for our All in the Mind webinar. And I'm very sure all our attendees, every one of us, has gained a lot of wisdom and practical advices which we will be able to apply in the workplace and even probably in our daily lives. And to wrap up today's online event, may I call on screen the Chief Sales Distribution Officer of Generali Philippines, Ms. Sharon Maranan.
Hello. Good afternoon.
Good
Good
afternoon,
afternoon,
ma'am.
Sharon.
Good afternoon, dear partners. On behalf of Generali, I thank all of you for attending our first webinar offering on mental wellness. I hope that you found the last 1 hour and 50 minutes very informative and helpful. As your lifetime partner, it is our goal to always provide you with relevant and up-to-date information on topics that concern the welfare of your employees. I'm sure we all agree that one of the most pressing concerns of any employer today is the mental health of his employees, especially under the COVID-19 crisis that we are all facing. Absenteeism, low engagement, low productivity in the workplace are all obvious effects of mental wellness issues that keep most of us people managers awake at night. But what we don't realize, and what is really an eye-opener for us, is that a lot of the medical conditions that show up in our medical claims utilization reports can be traced back to stress, anxiety, and depression, which are all mental health issues. The most obvious one, of course, is hypertension, which we all know is caused by stress, aside from wrong diet and lack of exercise. But even respiratory diseases like asthma, skin diseases like psoriasis, migraine headaches, back pain, UTI, and even the common cold can also be traced back to stress. So you might ask, anong relasyon naman ng common cold sa mental wellness? But you see, when we're always stressed and when we're always depressed, that also weakens our immune system. And then we become prone to infections like the common cold. So addressing the root cause will not only result to a more engaged and productive workforce, but it will also make our employees healthier and reduce the costs of our employee benefit programs. If you wish to take this a step further, Generali is very willing to partner with you in your mental wellness journey. Together, we can customize webinars or a series of webinars for your employees and even for your top management, designed to create awareness and promote mental wellness at work and at home under these very extraordinary circumstances. We can also make one-on-one mental wellness consults with our accredited psychologists available to your employees as part of your employee benefits program. Ika nga ni AJ at saka ni Noel, we can provide easy access to these one-on-one consults for your employees if and when they are needed. If you want to know more about these offerings, please get in touch with your Generali account officers. So again, thank you so much for being a part of our afternoon. We look forward to being with you again in our next webinar. So until then, please stay safe and stay healthy. Bye for now.
All right. Thank you, Ms. Sharon. And as Ms. Sharon mentioned, our team would be more than happy to support you, our dear clients, as you endeavor in a mental health inclusive work environment. So there you have it, everyone. Thank you so much for joining us this afternoon in our webinar session about the mental health. And it goes without saying that the integration of mental health care as part of basic health services underscores the fact that there is no health without mental health. So we look forward to see you again for our next webinars. Once again, I am Milka Javier of Generali Philippines. Thank you and enjoy the rest of the day. Happy weekend, everyone.